could improve migraine care?
As a scientist myself, I believe knowledge is power. And so what I would strongly suggest is family doctors and general practitioners to look up Migraine Canada.
My attention was drawn toward the Migraine Canada website. It is a terrific website. I thought I knew a lot about migraines, and I learned a lot more.
When I talked about this to my family doctor, they weren't even aware of this resource that's available.
There's just a lot of information there, kinds of treatments and medications.
Through these resources, they can understand and see what's the recent literature, what's the recent findings, and just to empower them so that they can help their patients.
On the website of Migraine Canada, you can get a lot of information, and it's also, you can know that these are true information, and you can listen to podcasts. It's a good tool to find some help as well.
I think that the more we educate not only the public, but even our government, the more they'll become aware that migraine is a neurological disorder that has a significant negative impact on people's lives.
Do you have access to a neurologist?
No, I don't.
Not right now.
Yes, I do have access to a neurologist.
I now have access to a neurologist, and that has completely changed my life. It took about 15 years to find a neurologist specialized in migraine disorder.
Every time that I ask for one, they usually tell me that there is a super long waiting list.
It was really my neurologist who was able to give me my magic cocktail that works most of the time.
I think Migraine Canada has a message to the society saying that as other diseases that we know much more about it, migraine does exist and it's painful and it's something to be considered.
Hopefully, this will help more funding on behalf of the government. Everyone deserves to have access to the appropriate care and also to affordable medication.
I think it's important to spread just general awareness. It's such an invisible pain that you don't really get considered.
I think it's important for people to, in each community, to really talk about it.
I think more compassion would be good also by them sharing information on this disease, because it's very painful for people who have it, very painful.